Electric body, electric mind too. How to apply the Alpha-Stim M for anxiety, insomnia, depression, and pain management. Please see the Alpha-Stim M Owner's Manual for more detailed information. Use the Alpha-Stim M with confidence. For most people, relief can be achieved with brief treatments every other day. Some people only achieve maximum relief when using the Alpha-Stim M for several hours every day or even all the time. This is rarely necessary, but not harmful. So use the Alpha-Stim M with confidence, knowing you have a safe and effective tool to help you experience life again. Because the Alpha-Stim M uses such a low level of current, many people do not feel anything at all, even at the maximum current level. Do not be concerned if you cannot feel the current. This is perfectly normal, and your perception of the current will not affect the results. The Alpha-Stim has a built-in test circuit that will alert you if something is wrong with the device. How to do a microcurrent electrical therapy session for pain management using the smart probes. Plug dual connector end of the wires into channel 1 or channel 2 and the pin plugs into smart probes. Apply probe electrode pads or PEPs to the probes by placing a clean probe tip into the PEP while the PEP is still in its case. Press power on. Set frequency to 1/2 Hz or desired setting. For joint problems such as shoulders, elbows, wrists, fingers, hips, knees, ankles, or toes, use 100 Hz for 10 to 20 seconds, immediately followed by 1/2 Hz. Try 1.5 Hz if 1/2 Hz is not effective. Set timer to probe setting. Set current on the channel in use to 6, which is 600 microamperes. When used on or near the head, immediately decrease the current if dizziness or nausea develops. This may happen initially or several minutes into treatment. Decreasing the current will immediately relieve these unpleasant feelings. Saturate the PEPs thoroughly with several drops of alpha-conducting solution. Repeat as necessary throughout the treatment. Evaluate your pain before, from time to time during, and after each treatment. This may consist of simply moving into a position that causes you to be more aware of your pain, then noting the level of pain you are experiencing from 0, meaning no pain, to 10 for maximum pain at the beginning and end of each treatment. Apply the probes to clean, dry skin. The treatment cycle will start with a dual beep on contact with skin and end with a single beep. Hold probes firmly against your skin for the entire 10-second cycle before moving to another treatment location. Lift one probe off of the skin and put it back down in the same place to repeat the treatment. 2 probes must always be used together to complete the electric circuit. Always place the smart probes on both sides of the area being treated to direct the current through the problem area. Continue treatment until pain is completely gone or substantial relief is achieved. There is usually an increased range of motion in treated areas. Sometimes treated areas of the body feel stiff or tight when the pain is gone. This will wear off over time. Finish your treatment with cranial electrotherapy stimulation. Smart Probe Treatment Strategy, Example 1, Knee Pain. Treat for the full 10 seconds. Start beyond the treatment area in at least 2 places, such as the entire leg for knee pain. Always direct the current between the probes to flow through the treatment area. Then, move the probes closer in and through the area being treated for about 1 minute. Apply the two probes to at least 6 different angles, with the probes always placed on opposite sides, such as front to back or side to side. Treat the same body part on the opposite side of the body in at least 2 places. In this example, treat the other knee. Connect the 2 sides of the body. Place one probe below the treatment area and the other in the same place on the opposite side. Repeat in a few places. For example, visualize a line under and around each knee, placing the probes at intervals along the line all the way around the leg below the knee. For best results, vary the probe placements until the pain is completely gone or maximum relief is achieved for that day. There is usually an increased range of motion in treated areas. Finish with cranial electrotherapy stimulation. Smart Probe Treatment Strategy. Example 2, back pain. Treat the entire back in at least 2 places. Move probes closer in, around, and through the area for about 1 minute. Apply one probe to the back near the spine at the area of pain, and the other on the opposite side near the front. Then again above and below. Followed by the same 3 placements on the opposite side. Connect the 2 sides. place one probe below the treatment area and the other in the same place on the opposite side. Repeat in a few places. For back pain, place probes in at least 3 places on both sides of the body at the level being treated and slightly above and below to direct the current through the nerves and spinal cord. Repeat as necessary, varying the probe positions. Continue treatment until pain is completely gone or maximum relief is achieved. Smart Probe Treatment Strategy, Example 3, Arm Pain. Treat beyond the treatment area to encompass the entire arm in at least 2 places. Then treat closer in, around, and through the area being treated for about 1 minute. Applying the probes at about 6 different positions. Treat the same body part on the opposite side in at least 2 places, such as the other elbow or wrist. Connect the 2 sides by placing one probe below the treatment area and the other in the same place on the opposite side. Repeat in a few places. For example, follow a line under and around each wrist, placing the probes at intervals along the line all the way around the arm below the wrist. Repeat as necessary, varying probe positions. Smart Probe Quick Treatment Alternative Strategy. To treat the neck and arms, including the fingers, hands, wrists, elbows, and shoulders, connect your 2 hands by placing one smart probe on one fingertip and the other smart probe in the same place on the corresponding fingertip of the other hand for 10 to 20 seconds. In other words, treat thumb tip to thumb tip on the other hand, index finger next, for all 5 fingers. The same strategy applied to the toes may be used to treat any problem in the legs, such as pain in the toes, feet, ankles, and knees, but not hips. Hip pain requires local probe treatment. Repeat as necessary, varying probe positions until your pain is completely gone or maximum relief is achieved. To treat pain with Astrode electrodes, plug dual connector end of the wires into channel 1 and/or channel 2 and the pin plug into Astrodes. Press power on. Set frequency to 1/2 Hz or desired setting. Set timer to 10, 20, 40, 60 minutes or continuous. This depends on the length of time necessary to effectively manage your pain. 20 minutes to 1 hour per Astrode electrode location is the usual treatment time. Set current on the channels in use to desired setting. Use 600 microamperes for maximum pain relief. Decrease immediately if it is uncomfortable. Use 100 microamperes when using electrodes for over 1 hour. Of course, you may increase the current as necessary to obtain pain relief, but it is better to reduce the current to 100 microamperes if possible when using the Alpha-Stim for long periods of time. Note the level of your pain for all areas being treated and any limitations of movement in joints before, during, and at the conclusion of treatment. Peel the self-adhesive Astrode electrodes off of the backing and save the backing to store the electrode after use. If the adhesive is drying out and the electrodes do not stick well, you may wet them with 1 or 2 drops of alpha-conducting solution and lightly rub your finger over the electrode to spread the solution into the electrode gel. Apply Astrodes to clean, dry skin. Place them so as to direct the current between them through the area being treated. 2 Astrodes must always be used together to complete the electrical circuit. Move Astrodes around as necessary to obtain the best results. Continue treatment until pain is completely gone or maximum relief is achieved. There is usually an increased range of motion in treated areas. Repeat the treatment as often as necessary. Replace Astrodes in the bag they came in and seal the bag. Discard and replace electrodes when they no longer stick well or when the adhesive has split or worn through to the conductive backing. Finish with cranial electrotherapy stimulation. Cranial electrotherapy stimulation to treat anxiety, insomnia, or depression with ear clip electrodes. Clean skin of earlobes with mild soap and water or alcohol wipes and allow them to dry. Plug dual connector end of ear clip wires into channel 1 or channel 2 jack. Remove old ear clip electrode pads if present. Attach 4 new ear clip electrode pads. Saturate the ear clip electrode pads thoroughly with several drops of alpha conducting solution while they are on the ear clip electrodes. Power on. Set frequency to 1/2 Hz. Set timer. 20 minutes is usually enough time if the current is set to at least 250 microamperes. 40 minutes to an hour or more is recommended if the current is at or below 200 microamperes. Squeeze ear clips open and apply one to each earlobe. Increase the current slowly until a dizzy feeling is experienced, like rocking on a boat. Then decrease it immediately until the dizziness stops. also decrease it if the normal tapping sensation felt on the earlobes becomes uncomfortable. For people who have a history of experiencing vertigo, which means dizziness, such as motion sickness, treat at a current setting of 100 microamperes for 1 hour or more to prevent residual vertigo after treatment. Relax, sit or lie down, and let the Alpha-Stim M relax you. You may also read, work at a desk, or watch television. Do not attempt to drive or operate dangerous tools or machinery during treatment. Always complete a cranial electrotherapy stimulation session. When the timed session ends, if a heavy feeling is still experienced, resume treatment until at least 2 minutes after the heaviness lifts and a light feeling develops. Cranial electrotherapy stimulation may be used as often as necessary, but for most people it is best to treat between once a day and twice a week. Results usually improve and last longer with additional treatments.